Now to our story of more dysfunction in Colorado's Medicaid system. Tens of thousands of people are unable to pay for the health care they need to survive.
Yeah, it's a story we've been following for months now for you. Your investigator, Katie Weiss, joins us now to talk more on this. Katie, things have not improved.
No, really, they haven't at all, Karen. Michael, I actually spoke with an owner of an assisted living facility who tells me that Colorado's Medicaid system, get this, owes him about $100,000 for his residents' care. And when we talked to him, he was in tears because he says he might have to even shut down if he doesn't get paid soon.
It's been very difficult. I've, as an owner, had to stop paying myself to try and make the budget work.
Justin Wiley owns Tender Care Assisted Living, 3 homes across Jeffco that care for adult men suffering from mental illness.
These guys are an absolute trip to work with. It's very rewarding.
His residents depend on Medicaid to live there, but for the last few months, payments haven't been coming.
And they tell me that, we'll transfer you to a supervisor, they'll call you back, but then I never get a call back.
And he's struggled to get any answers as to why or how to fix it.
I went up to the Medicaid Human Services Department directly, and their jaws about hit the floor when we walked in, going, "Oh my gosh, what are you guys all doing here?" And we're like, "We need help. We're not getting paid." And they're like, "We can't help you. We don't have anybody here today."
These problems have only increased for people like Wiley since the federal government started requiring verifications of Medicaid eligibility again last spring. That had been paused during the pandemic. People on Medicaid were supposed to receive packets in the mail on how to renew, but some of Wiley's residents say they never got anything.
It's stressful because you want to pay your rent and you want to do your part.
Sources tell us a host of technology problems with some of the state's software that processes Medicaid claims and payouts are partially to blame. And county human services departments are facing double the workload than pre-pandemic levels, but no increase in staff to manage it. Jeffco Human Services says it's made improvements and has added more staff, but still has a backlog of about 1,000 claims. Statewide, government data shows nearly 55,000 Coloradans Medicaid benefits were either still pending or denied for procedural reasons last month.
These houses are like a family atmosphere. You get your shelter, your food, and your medicine, and they're safe places to live. And if we didn't have it, who knows what would happen to us.
At my age, with my medical problems, if I don't have a place like this, I'm back on the street. And that's a death sentence.
Wiley's begging state and local leaders to do something.
When we get to the point where I can't cover the bills anymore, I'll have to shut the facilities down and basically tell these guys they've got to find another place to live. That breaks my heart. I can't even put it in words. I care so much about these guys, and even the thought of them being even one of them being on the street is just too much for me to handle. My emergency plan's to bring them home to my house because I don't know where else to send them.
Yeah, so after we contacted both the state and Jeffco Human Services last week about Wiley's issues, Wiley tells us he's getting much better communication now about the problems he's having, but that's still not all of his residents' claims have been fixed. And the state's Medicaid office tells us nearly all of his claims have been resolved and the remaining claims are escalated, and that some of the denials were because some residents had financial resources that exceeded what is allowed for Medicaid. Meanwhile, Jeffco Human Services tells me about half of his residents still need to send in some additional information. But in the meantime, you guys, Jeffco says it understands Wiley's frustrations, and they are working to move to what's called an individualized caseload system, where essentially owners like Wiley will only have one person, one phone number to call, and they can just deal with that one person at the Human Services Department to get answers to these kind of problems.
That would be so helpful, wouldn't it? That would be just fantastic in itself.
Yeah.
And Katie, we know that you're going to stay with us and continue to find out what is going on here.
Yeah, absolutely. There's a lot that we're going to continue to look into. We're putting in several requests for more information about these state software technology problems that sources are telling us about. And as soon as we learn more about the reasons why these issues are happening and how they're going to be solved, what's going to be done about it, we'll be letting you and all of you know as well. Because, really, we know many of these facility owners, just like Justin Wiley, are also on the brink of shutting down.
Yeah, it's a really scary situation, Katie. We know you'll keep us abreast of what's going on. Thank you.